NEC 517.18 applies to pediatric exam rooms. This section of the National Electrical Code requires that all receptacles in a pediatric exam room of a doctor's office be served by at least one 20-ampere branch circuit that is dedicated to that space and no other outlet or device. However, there's an exception to NEC 517.18 when an emergency generator is not installed. This exception allows the use of a single 20-ampere branch circuit to serve all receptacles in the pediatric exam room, all receptacles in the procedure room, and all receptacles in the nurse's station. If you choose to use this exception, there are specific requirements that must be met. Firstly, the branch circuit must be identified as serving the pediatric exam room, procedure room, and nurse's station. This identification should be clear and permanent. Secondly, a sign must be posted at each receptacle stating, "This receptacle is not served by the emergency system." This ensures that users are aware that these receptacles will not have power during an emergency. Thirdly, the branch circuit must be connected to a separate overcurrent protective device, which could be a circuit breaker or a fuse, on the load side of the emergency source. This provides an additional layer of protection. Beyond these specific requirements, there are additional considerations to keep in mind. It is always recommended to consult with a local authority having jurisdiction (OJ) for specific requirements in your area, because local codes can vary and the AHJ will have the final say on what is required. If possible, it is generally preferable to provide an emergency generator to ensure uninterrupted power to critical equipment in the pediatric exam room. This can be especially important for life support equipment or other devices that need to function continuously. Finally, battery-operated portable power sources may be considered as an alternative to a generator in certain situations. These sources can provide temporary power during an outage, but they may not be suitable for all applications. To reiterate the key points, if an emergency generator is present, a dedicated 20-ampere branch circuit is required for the pediatric exam room receptacles. If there is no emergency generator, a single 20-ampere branch circuit can serve the pediatric exam room, procedure room, and nurse's station receptacles, provided that you properly identify the circuit and post the required signage at each receptacle, and have it connected to an overcurrent protective device on the load side of any emergency source. Always verify local codes and with the AHA. Let's delve a little deeper into some of the reasons why these requirements exist. Pediatric exam rooms often have sensitive medical equipment that requires a reliable power supply. Ensuring a dedicated circuit or a backup power source minimizes the risk of power interruptions that could compromise patient care. The requirement for signage is crucial for safety. In the event of a power outage, healthcare professionals need to know which receptacles are still operational and which are not. This allows them to quickly connect critical equipment to the appropriate power source. The overcurrent protection requirement is a standard safety measure to prevent electrical fires and equipment damage. By using a separate overcurrent protective device, you can ensure that the circuit is properly protected in the event of a fault. Now let's talk about some practical considerations for implementing these requirements. When identifying the branch circuit, be sure to use a clear and durable label that is easily visible. You might use a label maker or a permanent marker to create the identification. When posting the signs at each receptacle, make sure that they are securely attached and that the text is easy to read. The signs should be placed in a location where they will not be obstructed by furniture or equipment. When connecting the branch circuit to the overcurrent protective device, be sure to follow all applicable electrical codes and safety standards. It is always best to hire a qualified electrician to perform this work. In addition to the requirements outlined in NEC 517.18a, there may be other electrical codes and standards that apply to pediatric exam rooms. For example, there may be requirements for grounding, bonding, and surge protection. It is important to be familiar with all applicable codes and standards before beginning any electrical work. When considering battery-operated portable power sources as an alternative to a generator, there are several factors to take into account. Firstly, you need to determine the power requirements of the equipment that you will be powering. Secondly, you need to choose a power source that is capable of providing the necessary power for the required duration. Thirdly, you need to ensure that the power source is properly maintained and tested. It is also worth noting that some medical equipment may not be compatible with battery-operated power sources. It is important to consult with the equipment manufacturer to determine whether a particular power source is suitable. The NEC is a comprehensive document that covers a wide range of electrical safety topics. It is updated every 3 years to reflect the latest advancements in technology and safety practices. It is important to stay up to date on the latest version of the NEC and to consult with qualified professionals where necessary. The AHA plays a critical role in ensuring that electrical installations are safe and compliant with applicable codes and standards. The AHA is typically a local government agency or a private organization that is responsible for enforcing electrical codes. It is important to work closely with the AHA to ensure that your electrical work is approved and that you are in compliance with all applicable requirements. In summary, understanding and complying with NEC 517.18 is essential for ensuring the safety and reliability of electrical systems in pediatric exam rooms. By following the requirements outlined in the code and consulting with qualified professionals, you can create a safe and functional environment for patients and healthcare providers. Remember that even if an emergency generator is not present, careful attention to the exceptions requirements, including proper circuit identification, signage, and overcurrent protection, is paramount. Furthermore, regular communication with the AHA and staying informed about the latest code updates are vital for maintaining compliance and ensuring patient safety. Let's further expand on some of the practical considerations and best practices when implementing these electrical requirements in a pediatric exam room. Firstly, consider the placement of receptacles. They should be strategically located to provide convenient access for medical equipment and other devices, while also minimizing the risk of tripping hazards or accidental damage. Think about the typical layout of the room and the types of equipment that will be used, and then position the receptacles accordingly. Secondly, choose high-quality receptacles that are designed for heavy use. Pediatric exam rooms can be busy environments, and the receptacles will likely be subjected to frequent plugging and unplugging. Selecting durable receptacles will help to ensure that they last for many years. Thirdly, use tamper-resistant receptacles, especially in areas where children may be present. These receptacles are designed to prevent children from inserting objects into the slots, which can help to reduce the risk of electrical shock. Fourthly, consider the use of isolated ground receptacles for sensitive electronic equipment. These receptacles provide a separate grounding path that can help to reduce electrical noise and interference. Fifthly, implement a regular inspection and maintenance program for the electrical system in the pediatric exam room. This program should include periodic checks of receptacles, wiring, and other components to identify and address any potential problems. Sixthly, train staff on basic electrical safety procedures. This training should cover topics such as how to identify electrical hazards, how to use electrical equipment safely, and what to do in the event of an electrical emergency. Seventhly, keep accurate records of all electrical work that is performed in the pediatric exam room. These records should include information such as the date of the work, the name of the electrician, and a description of the work that was performed. Eighthly, when selecting an electrician to perform electrical work in a pediatric exam room, be sure to choose a qualified and experienced professional. The electrician should be licensed and insured, and they should have a good understanding of the NEC and other applicable codes and standards. Ninthly, consider the use of energy-efficient lighting and other electrical equipment in the pediatric exam room. This can help to reduce energy consumption and lower operating costs. Tenthly, make sure that the electrical system in the pediatric exam room is properly grounded and bonded. This is essential for preventing electrical shock and ensuring the safe operation of electrical equipment. These best practices, combined with a thorough understanding of NEC 517.18 and other applicable codes and standards, will help to ensure that the electrical system in a pediatric exam room is safe, reliable, and functional. The ultimate goal is to provide a comfortable and safe environment for patients and healthcare providers. Remember to consult with the AHA and qualified professionals throughout the process to ensure compliance and best practices. A properly designed and maintained electrical system is a critical component of any healthcare facility, and it is essential to take the necessary steps to ensure its safety and reliability. Also consider the specific needs of the equipment being used. Some medical devices require specific voltage or amperage, or may have unique receptacle configurations. Always consult the manufacturer's specifications to ensure compatibility. If the pediatric exam room is part of a larger medical facility, coordinate the electrical design with other departments to ensure consistency and integration. This can help to simplify maintenance and reduce the risk of errors. When making decisions about electrical systems in healthcare facilities, always prioritize safety and reliability. These are the most important factors to consider, and they should guide all of your decisions.